Hello, welcome to Education Forum. I'm Maureen Babidia, and it's always a pleasure to bring you the developments in the education sector. I'm here at Health Tutors College Mulago, where I will explore how competence-based trainings have improved healthcare service delivery in Uganda. Join me as we interview and navigate the different administrators, students, leaders in this college. To begin the show will be Dr. Karen, the principal of Health Tutors College Mulago, who will fully introduce herself shortly and tell us all about the college and what her role is. You're welcome. It's a pleasure to have you, madam.
Okay, thank you. Nice to be here with you today at Health Tutors College Mulago. My name's Dr. Karen Carol Dratero Aikobwa, the Principal Health Tutors College Mulago. Health Tutors College Mulago is a tertiary institution which is under Ministry of Education and Sports. Much as it is a tertiary institution, we have degree awards, and that is with affiliation to Makerere University. So the college was established way back in 1967, and we've been in place since then. It was started to have nurse tutors in the country, because before that the country used to send nurse tutors outside the country for trainings, and when they realized that was very costly for the country, then they started the training in the country. That was in 1967, and by then the school was under Ministry of Health, and when it started, it used to have a small population of about 7 to 10 students at a time. And it was 2 years training for diploma, but they would only admit when the first group has already finished. But today, we have grown. The college now has 3 programs which are on running. We have Bachelors of Medical Education, we have postgraduate medical education, and we have higher diploma clinical instruction. And soon we are starting a new program that is a leadership and management of health training institutions program. So with those programs in place, our population has grown from a class of 7 to 14 students. Today we have a class of 50 to 100. And with that, you find the postgraduate class has more students, because now there's many students outside there who have done the bachelor's programs, and now when they come here, they only come for the pedagogy component. So their number is bigger than those who come for Bachelors of Medical Education. But the ones who come for Bachelors of Medical Education is a 3 years program. Meanwhile, the postgraduate is for 1 year. So you can also see why the other ones are more.
Yeah.
And it is a weekend program, the postgraduate medical education. So since it is a weekend program, it is more friendly for people who are working. And they can work Monday to Friday, and then they come here for a weekend program, and it is more friendly for them to be here with us. Unlike the Bachelor of Medical Education, which is 3 years program, and it is full time. So one must come and be here. And yet now the challenge we have, the Bachelor of Medical Education candidates, they are working under Ministry of Health. And now the schools are under Ministry of Education and Sports. So when they come for tutorship training, Ministry of Health looks at it that from here you are not coming back to us. So what are we going to benefit when you finish? So we are not releasing you to go for this training.
Yeah.
So it becomes a challenge. So the numbers are few, those who manage to get permission to come for the program. That's why the numbers are lower than the postgraduate. Yeah.
Now, Doctor, to most people, an institution like this one could be categorized under the Ministry of Health. To others, it could be categorized under the Ministry of Education and Sports.
Yes.
Which one do you fall under particularly?
Okay. Thank you very much. Where we belong, we belong to the two ministries. Our mother ministry is Ministry of Health because we belong to health. But the fact that we are a training institution, we also belong to Ministry of Education and Sports. So we are in the middle.
Yeah.
Why do I say that? When it comes to practice, we use the health facilities for our clinical practice. And some of our supervisors also come from Ministry of Health. And at the same time, Ministry of Education and Sports is also our mother ministry at the same time because we are in education. We used to be fully under Ministry of Health, but in 1998, the government of Uganda decided that all training institutions must be transferred to Ministry of Education. So all training institutions were then transferred from their mother ministries to Ministry of Education. And that's when we moved to Ministry of Education. But the fact that we still have the clinical practice where we have to go to the health facilities, we still have touch with the Ministry of Health as our supervisors.
Okay.
Yeah.
Now, Doctor, to my knowledge, this college has been in existence for over 100 years.
Yes.
Is the college still serving the purpose for which it was started?
Quite true. We've been in existence for over 100 years. We actually celebrated our Jubilee anniversary in 2017, yeah, and it was very wonderful.
Okay.
We enjoyed ourselves and we felt so big for having lasted for at least 100 years. And the purpose for which the college was introduced was to have a training of trainers for the health training institutions. And to date, we still do that. Only that in the beginning, they were only training the nurse midwifery tutors. But to date, you find we have brought on board the allied health, that is the paramedicals, the laboratory, the physiotherapists, the orthopedics, the dental assistants, and all of them still come. So instead of having the nurse tutors, now we have health tutor training ongoing. And we even have some doctors who also come for this training.
Okay.
So now we are more diverse than the purpose for which it was introduced because of the diversity of the growth that the country is having.
Okay.
So at least we are growing. Yeah.
Now, on that note, Doctor, do the programs offered here align with government's development programs in regards to health care?
Yes, we do. Because as we are operating, we still use the government policies or the government laws. For example, we use the University and Tertiary and the other Tertiary Institutions Act of 2001. And then we also use the Education Act of 2008. And we still use the government constitution, which are all the laws that the government has put in place in order to ensure that our running of the institutions is in line with the government policies. We do not run independently. Yeah.
Now, Doc, I'd like you to give us an estimate on the population of your students currently.
Wow. Okay.
And staff.
Okay. Currently, the student population is about 300 students, and this is comprising the higher diploma clinical instruction, the Bachelor of Medical Education and the postgraduate medical education. So on average, our population is now 300. But you remember where we started? It was an institution of about 14 students only. But now we're on 300. So our population has grown. However, when it comes to staffing, it is a small population.
Okay.
We have about 34 full-time staff. That is including the teaching and the non-teaching and the support.
Okay.
The teaching, we have on about 9 full-time teaching staff, including the principal. And then we have the non-teaching, that is the secretaries, the library assistants, the ICT department, the kitchen, and then the support staff makes up about the remaining, and to make it up to the 34, 37. So that is the staff population. Now, when it comes to teaching, the kind of students that we handle, as I told you, we have the nurses, we have the midwives, and we have the allied health. And the allied health has about 23 different disciplines. So you find all these disciplines, the teachers to go and train, all must come from here. And by the way, this is the only health training institution for government in the country, actually the whole of East Africa, maybe even Africa.
What?
Yes, it is the only institution of its kind. We have one in TZ, but the one of TZ, what it does, it trains postgraduates.
Only.
And it only handles pedagogy section. But for us here, we do both pedagogy training, and also we touch on to the basic health training component in order to bring the trainers at a higher level than the students that they are going to train.
Okay.
So that is what we do. Now, what does that entail? It means you must bring different persons to come and train in all these disciplines that you have. So most of the people are part-timers. You find in a semester, you have about 30 to 40 part-time lecturers coming on board because of the different disciplines that the students have. So you must bring in all those who have candidates so that they are taken through their area of field. So it helps it makes the institution incur a lot of the part-time lecturers. And the challenge is the government cannot bring all these disciplines for full-time job. Why? Because you find some of the semesters, you don't have a course unit for some of the course units. So you'll find that teacher remains redundant for a whole semester without going to the classroom. So it takes us to more of part-timers. So when you ask about the staff population, I don't know which one I can give you. So it is a bit of a challenge.
Okay.
Thank you.
Are there any long-term expectations and achievements you'd like to see the college achieve in the long run as principal?
Yeah. Now that things are changing, a lot is coming in place. We are having a lot of specialties in the health facilities. We are looking at changing from only training health tutors to also bringing on board training specialties in the health training areas. Because now, as we intend to grow in the college, we cannot only have one discipline which is running, because our target is to become independent tomorrow as a degree awarding institution, not to remain affiliated to another university forever. So as we plan to grow, we advocate to bring in more other disciplines for training so that we have a number of departments that can make up for a university. And then also our lecturers are also upgrading themselves to be able to handle the training of the different disciplines that we tend to bring in place. And currently, we have the strategic plan, which was a 10-year strategic plan, and it is expiring by next year. So right now, we are evaluating the strategic plan to see what did we do well, what didn't we do well, what next can we do.
Yeah.
So as we are evaluating, we are planning to see that we now bring on board other areas which we have not tackled to also boost us. And one of the good things which has come in the right time, the government recently phased out some of the PTCs, that is the teacher training colleges.
Yeah.
So by good luck, the Health Tutors College was repurposed 2 colleges. That is one in the east, Bukedea, PTC, and then also in the north, that is Christ the King, PTC in Gulu. So we are planning to extend so that we have other campuses for the college. And once we have those colleges, then we shall be able to expand our services better.
I'm honored to be joined by the academic registrar here at Health Tutors College Molago. He will be introducing himself and telling us more about his roles here at the college. You're welcome.
Thank you.
Yes, please tell us more about yourself.
Yes, viewers, thank you. I'm called Okoth Ogenda Constantine. I'm the academic registrar of Health Tutors College, Mulago. Yeah, you're welcome.
And break it down for us. What does your role entail?
So as an academic registrar, there are 3 major roles. One, academic registrar deals with drawing out the programs for the institution, the entire program, academic, non-academic, so that the college is given a direction depending on the program he has drawn. Then 2, another role is keeping records, up-to-date records of the institution, the records of the students majorly, their intake, their results, their performance, and all what is required about a student. Then lastly, the academic registrar prepares a way how the institution recruits new students. Yeah, so for example, we had new students this year, but next year from January, there's another application
That
coming.
is when the enrollment
No, the application.
application.
Yes, and these days, you know, everything is online. So by around mid-January, the new intake start applying. Yeah.
You have portals online where they can apply without
Yes.
coming directly to
Yeah.
the college.
For us here, we are affiliated to Makerere. So if somebody wants to apply here, you apply through Makerere portal, not ours here. So everything's under Makerere.
Okay. Now, as the academic registrar, please take us through the programs that are offered here at this college.
First and foremost, Health Tutors College deals with the training of tutors. Now, what category of tutors do we train? We train tutors who teach health workers. For example, if a student finishes senior 6 and wants to become either a nurse, a radiographer, or whatever,
Yes.
the tutors who qualify from here are the ones who teach them. Yes. So it gives us 3 major programs. We have a Bachelor of Medical Education. It is a 3-year program. So we have a Bachelor of Medical Education year 1, year 2, and year 3 right now. Then we have a postgraduate diploma in medical education. That one is a 1-year program. Then we have a higher diploma in clinical instruction. It's also a 1-year program. Yeah.
All right, now who qualifies to be admitted here?
If you are to come here, I will break a bit. So if you are to come for higher diploma, you should be having an ordinary diploma in either nursing, midwifery, or allied health related subjects. Okay. Now when you talk about allied health, there are about 21 course units that make up allied health. So I may not break one by one, but you have radiographers here, entomologists, and many others. So you must be having an ordinary diploma. Now, to come for Bachelor of Medical Education, you should also be having an ordinary diploma, only that you stay here for 3 years. Higher diploma, you stay here for 1 year, that's the only difference. But the intake is the same requirements. Then for postgraduate diploma, you must be having a first degree in any of the health-related disciplines. You can be a doctor, you can be a nurse, you can be a medical assistant, you can be a midwife, but as long as you have a first degree, a bachelor's degree, we take you. It is also a 1-year program.
Okay.
Yeah.
You talked about applications starting effective January.
Yes.
When does it close? What is the span for applications?
It is between January and March. Beginning of January and end of March. But sometimes when we don't attract the number we want, we open again. Okay. But we rarely go beyond May. Okay. Yeah. So we can say application time is between January and May. Okay. Then May and June is preparation for their documents, going through their documents, and seeing those people who qualify. Then August, the intake starts. So admission is between July and August. Okay. Yeah.
Now, what is the mode of teaching here at the college?
Okay. Now, in the 3 programs, Bachelor of Medical Education is full-time, meaning it is face-to-face. You are here from the first day of the semester up to the last day of the semester. So it is full-time. That's what we mean by full-time. Now, higher diploma, we use what we call modular approach. Okay. You come for a particular module, then you break, you go and do other things or other readings from your workplace, then you come back to finish the semester. That's why we call it. So you go with modules. And each semester will have about 3 modules which will come. Yeah. Then postgraduate, we use weekend program. So start on Friday at 2 up to 8 p.m. Saturday we start at 7:30 up to 8 p.m. Sunday we start at 7:30 up to 4. So we stop at 4 because they have to travel back to their workplaces. Yeah. So that's how we do it. But around COVID time, we went online also through this team viewer program. Because that time we could not bring them here. But now that things are okay, we went back to the normal program.
I'm glad to be joined by the Guild President of Health Tutors College Mulago. He will be telling us more about his role and what he does here. You're welcome. Please introduce
Thank you very much. And I'm so happy to be here and to be with you people. My name is Kakembo Musantambi, and I'm the Guild President of Health Tutors College for the year 2023-24. And my roles as the Guild President, not so many. I'm the conduit of the students' body to the administration, whereby if students have an issue, they raise it through a number of channels, which I can detail later on, and once they reach me, I deliver them to the administration, and once they are digested by the administration, solutions can be discussed, and then the problems are solved.
Now,
That is one. Number two, I also help to relate the students' body here to the students' bodies elsewhere in other institutions by relating and coordinating with guild leaderships in other institutions. And this we do through the body that joins and acts as the umbrella body for all students in Uganda, called the Uganda National Students Association, the UNSA. So through UNSA, we relate with other guild leaders to know if they have similar challenges like we do here, how do they go about them, so that we can also copy their approaches to solve the challenges we face here.
okay.
Yes.
Now, we've seen in higher learning institutions, it's mandatory to have a guild president, but in your case, you're a medical guild
True.
president. This is typically a medical institution. What other role do you play unique from other guild presidents?
Okay. Being a health-related institution, we're training health workers to become tutors or lecturers of tomorrow's health workers.
Yes.
And therefore, our roles as guild presidents of such institutions are quite diverse. We deal and also make sure we handle health issues of fellow students. And how we do that, we have a sick bay, or we call it the institution clinic. In case of an issue that needs medical attention, being that we ourselves are medics, we handle that. In case of maybe mental issues, mental health, we have counselors in different disciplines, psychiatrists, who can help us in that issue.
Okay.
Yes.
Now, I don't know how the criteria for choosing people on your cabinet is. Could you take me through that and how those student leaders are chosen to be on your cabinet?
All right. Like any other governance or government, the guild government has a number of steps or levels, wherein the guild president is the head, who also selects a vice president, selects ministers to
Yeah.
run different ministries,
Yes.
and also have representatives for different what we call constituencies.
Yes.
But these constituencies in our aspect here, actually the different disciplines, specialities like allied health, the nurses, the midwives, dentists, medical officers. We have those different disciplines that we call constituencies. So we relate with those and we appoint respective representatives for each. So we have representatives for each of those constituencies, and once they come, we form what we call the GRC. They compete and they are elected by the students' body.
Yeah.
We form the GRC, and for the ministerial positions, I appoint ministerial positions from among the GRC members. And once I nominate a particular name or names, the GRC members have the responsibility of vetting the different names that have been nominated. Once they are vetted and confirmed, they hold the different ministries.
Do the students play a role in this choosing of
Of
representatives?
course, they do.
Okay.
There is a proper election that takes place
Okay.
where people campaign and compete against each other
I can
for a
remember
particular
that.
position.
It must be fun. Is it
Yeah,
fun?
it should be, and it is, because it's healthy.
Okay.
Yeah.
In case of in case there's student needs and they need to be voiced, do they have to come through you directly, or there's protocol that's supposed to be followed?
Definitely, for any good leadership, there is always protocol. Because if it's only me, that would be very autocratic. So we have class representatives of each year, through whom the students will voice their issues, and the class rep will bring the issues to the GRC. At the GRC level, we discuss them, and we forward these issues to the administration. When they reach at the administration level, the administration will see the best way to solve that particular issue. And in case there is a need to raise it higher, we also have a governing council
Okay.
where the administration will forward the issue to have an amicable and reliable solution to the problem.
Okay.
So there is a protocol, a chain, a hierarchy that we go through to have an issue solved.
Okay.
Yeah.
As guild president, are there any privileges that come with being a medical guild president?
Medic or medical guild president is only because we are medics, but we, as the other guild presidents were, the privilege is mainly the link that we get as a platform of exposure that we get to meet people in bigger offices, people in the ministries, Ministry of Health, Ministry of Education, and that gives you the opportunity and the chance to relate with those people for future opportunities in case they come up, because you get to get their contacts, they get to know you, and also you get to know them.
Okay.
Yeah.
Does this platform here, if you're guild president here, does it, if in case you wanted to pursue like maybe politics somewhere, is this a fundamental step?
I believe it contributes depending on an individual's aspirations.
Okay.
If one wants to aspire for future politics, this can serve as a stepping stone,
Yes.
informing the electorate how you led a particular area of people and how good you are, so that you don't look a newbie.
Even in the different institutions you could be
True.
assigned in, yeah.
True.
Okay.
So it acts as a stepping stone, I believe. It will contribute if you have the aspiration to go further.
Okay.
Yes.
Are there any challenges you faced as a guild president so far?
Definitely, as a leader, there will always be challenges. There will always be challenges. But amongst the many, you want to serve the student's body, but you also want to maintain the discipline and sanity in the institution. Sometimes students feel like you will not serve their purpose so well. Sometimes they feel like maybe you're not delivering their issues. But when you try to elaborate your way of doing things to them, they finally understand. But as an individual, it challenges you. There will be some doubts here and there, but you explain to them and they will understand.
As a leader in the college, how do you deal with indisciplined students?
Luckily here at Health Tutors College, being an institution of health workers, we're all grounded in discipline.
Okay, that's
The
good to know.
ethics that is inculcated in us in our prior trainings helps us behave in such a mature way that it's not hard here. People
Okay.
are really disciplined. You hardly find any riots, you hardly find any fights, because people are mature and people are medics, so they have the ethics of conduct.
Okay.
And that's not a big issue here.
Oh, okay.
Yeah.
That's interesting. Thank you so much for your time. It's been an honor to speak with you.
It's been a pleasure too.
And as a follow-up, I'll be engaging with some students to tell us more about their academic and leadership roles
Okay.
at the college.
Thank you very
Stay
much.
tuned. Now I'm joined by one of the students at the Health Tutors College Molago. He'll be telling us his names and what he majors in. You're welcome.
Yeah, thank you so much. My name is Derek Niwamanya, and I am a medical clinical officer, and I am at Tutors College to study how to teach fellow clinical officers.
Okay.
Yes.
Now, first off, what inspired you to pick this particular course?
Yeah, after my specialization in clinical school, I was working in hospital and I would interact with students that are under health training schools. But they always come so that they learn. So as health professionals, we're supposed to teach. It's an on-job training.
Yeah.
So even students, we are supposed to know how to teach them. If you have a skill, we call it skills transfer. Yeah, so I felt I needed to get skills on how I can teach the things I know to someone else.
Okay.
Yes.
There's this notion that sciences are so hard and people that choose sciences are so smart, they're genius. Do you think it's hard now that you're training to actually go and teach other people that know what you already know? Is it challenging? Does it?
I think sciences are enjoyable. There's lots of people that are doing biology, there's lots of people that are doing chemistry,
Okay.
and I find it really interesting. So I think these sciences are enjoyable, and people also enjoy being scientists and health professionals for that sake.
Is it for the money or just they enjoy it? Are there people that enjoy
Well, there
it
is
or for the-
passion and there's also money.
Okay.
Yes.
What's yours?
Mine is passion.
And money, accept.
No, mine is passion. And yes, I like to share the skills that I know. Yes.
How has been your experience so far as a medical, student so far?
I think so far, I've liked the course. Learning tutorship, medical education is good. It gives us more knowledge on our profession, but also gives us what we call the pedagogy skills.
Okay.
How I can be able to transfer what I know to someone else. So it increases on the knowledge I have. If I know how to give an injection when I come here, they actually teach me better skills on how to give an injection.
Yeah.
So by the time I leave this place, I'm a better clinical officer, I'm a better nurse, but also I know how to teach fellow nurses and clinical officers.
Now, you mentioned that you were working in a different medical institution before you joined here.
Yes.
Are you assured of employment after school? What is your expectation?
Yeah, there is surely a lot of expectations after this,
Okay.
because there are many medical institutions that are out there, and you find a school is being run by about 3 tutors, but we need to have 8 or even more than that.
Yeah.
So there are jobs out there, and I am expecting that after my course, I'll be able to reap much from it.
Okay.
Yes.
That's good to know. Are there any challenges you faced as a medical tutorship?
Well, doing medical tutorship is not as easy as it sounds, because first of all, we get challenged when we come to the course. We think we already know enough of medical,
Yeah.
and when we reach here, we expect to only learn how to be a teacher.
Oh.
Unfortunately, when you reach here, then you're bombarded with more science, and then a lot of teaching and some kind of arts. So we are sciences, and when you come here, you find some kind of arts, pedagogy, sociology. So it's a challenge to those that come and they are pure scientists.
Okay.
Yeah, but also, you see, this course is a post-basics training course. So most people will come in, we have a family or we have some responsibilities, we've been at work, but we still need to study. So you find you have to balance between work and study, and the course is full-time. Yeah, so most of us will live here, we are adults, and we have to start again from zero, because you've left the job to come and study again.
Yeah.
Yes.
I'm now joined by another student who will be telling us their names and what they major in. You're welcome. Please introduce yourself.
Thank you. Thank you so much for this opportunity. My name is Nambia Dina Priscilla. I'm a student, a third-year student, Health Tutors College. My major background, I'm a clinical officer. So I have a diploma in clinical medicine and community health. Yeah, and I am currently the governor, students representative to the governing council, Health Tutors College 2023-2024.
How long does that course go for?
3 years.
Oh yes, 3 years you mentioned. Now, I'd like to know, what has been your experience from the first year you joined, now you're a finalist. How do you feel?
Oh, I actually feel so excited being my final year,
Yeah.
but as well, it hasn't been an easy journey, obviously, because being here, it means you have to leave certain things that you were previously attending to.
Yeah.
And yeah, it's so far been a little bit, up and down, but we've managed to come this far.
Okay.
Yeah.
Are you the people that were sitting for your finals when we walked in?
Yeah.
Oh, that's interesting.
Yeah. We are doing
And
fine.
on that note, how has been this medical tutorship course for you? Are you excited to go and, extend your knowledge that you're acquiring here?
Yes, I am so excited because before joining Tutors College, I was already teaching somewhere, and yeah, as a retained student, it feels like you feel like, okay, you can do it, but when you come to Tutors College, you basically get the skill.
Yeah.
Teaching is an art and a science in itself,
Yes.
so it's not all about going in front of students and delivering the knowledge that, it's more than that. So I'm excited, I've got a lot of skills, and yeah, they're really going to help in my delivery.
You're ready.
I am ready and excited of the field.
You're not worried about the employment scuffle going on outside there?
On my side, I'm not worried because I feel like I've got the skill that is really needed out there. So if someone wants the skill, I am here.
Okay.
Yeah.
Now, there's this narrative that goes around right from primary, secondary, all through uni, that sciences are meant for boys. How true is that? Because, you're here, you're doing it. How has it been for you?
I I think that is what people out there think, but sciences have no limit.
Yeah.
We're in a world where we need gender emancipation, and everyone, I mean, we can do things equally, of course, apart from a few things. Yeah, and coming to sciences, personally, I've been excited. I've been doing well throughout my field, and I believe anyone, as long as you set your mind to do it, I believe you can do it. Yeah.
Definitely. Earlier, when we interacted with the head of library, he mentioned that the number of girls that frequent the library are way less compared to the boys. How true is that? Where do you read? Where do you do your revision?
Oh yes, I am among the people, among
We
the
don't go to
ladies.
the- we don't visit?
No. I'm among the ladies that actually use the library.
Okay.
My records are there. I currently have like 3 books that belong to the library, so
Okay.
I'm a daily user. But when we look at the population of Health Tutors College in terms of, you know, the males versus the females, the male population is bigger than the females. So even when we are trying to look at how many people are using the library, it's
Yeah, it can't be
definite
the
that the
same.
males will be more than the females. But putting that aside, this is like a post-basic training institution. So people have different engagements and, you know, roles they have to do aside of teaching. As a female, I'm sure when some of them finish with the classes, they're able to go back and attend.
Yeah.
But the differences in attendance, I attribute it to the population on enrollment. Few ladies versus the males.
Okay.
Yeah.
Is this a live-in institution or you can be allowed to commute?
It's not a live-in institution. We only have a few rooms that you're seeing up there. Those belong to the guild leaders, the leaders of the institution. But the rest of the students are coming from home and coming from the areas around the institution. Yeah.
Are there any challenges you faced as a female medical, you know, tutor in the making?
Like within the institution or outside
Within the
the
entire,
institution?
generally, are there any challenges you faced since you started your, of course, your course here?
Oh yeah, definitely there are challenges because first of all, being a female, it means there are certain activities that they would require someone to do, and they need you to go out there for maybe 2 weeks, 1 month plus. And if you're a female who has a family and, you know, children and
yeah,
partner
they
to
depend
attend
on
to,
you.
it really becomes hard for you to divide yourself this side and also this side.
Yeah.
So that is the challenge. Otherwise, the rest of the things in terms of attendance, being able to understand what is being taught, it's perfect.
Okay.
Yeah.
Thank you so much for your time.
Thank you
I
so
wish you all the
much.
best
Thank
in your
you.
journey, and
Thank you so much.
may God see you through it all.
Amen.
And
Thank
that
you.
is all we had from the students here at Health Tutors College Mulago. Stay tuned for more. A library is known as a source of knowledge and information. Now I'm standing here at the college library in the section of medicine and related subjects. I have a book that caught my eye. It's titled Taking Charge of Your Fertility. Intriguing, right? But without any further ado, I'll be joined by the head of library who will be telling us more about his department. You're welcome.
Thank you so much.
Please tell us more about yourself and your
Thank you
role.
so much, UBC. Stephen Mangeni is my name. I'm the librarian of Hostas College Mulago. I once again welcome you to Hostas College Mulago Library. This is a place where we provide information to support the teaching and learning process in this college. So you are most welcome.
Thank you.
Yeah.
Now, as the head of library at this college, what role does a library play in the learning process of a student here?
Wow, the role of the library in the teaching and learning process. But before I talk about the role of the library, I mean the role, what the library contributes to the teaching and learning. I'll first tell you that in this college, Hostas College Mulago, the college is operating a competence-based curriculum. And with the competence-based curriculum, our library is designed to support the competence-based curriculum. So apart from providing the information in all formats, that is physical and any other form of information to support the teaching and learning process, our library goes ahead to provide a conducive learning environment. Because if you look at the physical appearance of the library alone, can really confirm to you that our library provides a conducive learning environment.
Very quiet.
Then when you enter our library, you also see, you can appreciate that we have the discussion rooms that are meant to enhance active teaching and learning, because by allowing our students to carry out group works, group discussions in the library, we are trying to incorporate libraries in the active teaching and learning process. So our libraries it is designed to support competence-based learning. Then if you come to our library also, you realize that we provide a platform whereby students and lecturers can discuss one-on-one
In the library?
in the library. And then also realize that our library also, we have internet services that supports, like by providing information to the learners. So in that way, we are trying to support teaching and learning process in the college. Yeah.
Okay. Now, you've spoken about an extra room for discussions.
Yeah.
Doesn't it disrupt the rest of the students that are seated outside?
Obviously no, because you see there are even partitions which are soundproof, so it cannot
Oh, it is
allow that.
soundproof.
And then in this era of active teaching and learning, then we allow students to interact with one another.
Okay.
It's not about confining people in the library. Library is not a prison whereby people have to be restricted. They should not discuss with one another. At least there are provisions. Apart from this one, the discussion room, we also have the computer lab,
Okay.
whereby people can do different activities of teaching and learning. So really we just try to support the ATL, active teaching and learning, and the competence-based curriculum as
Okay.
much as we can.
Okay.
Yeah.
How equipped is the library here?
Well, our library is, also when it comes to the level of stocking the library, of course the college administration has the budget for the library,
Okay.
and you realize that every year we buy books for the library.
Also, it's restocked yearly.
that caters for all subjects
Okay.
that are taught in the college. Then apart from the budget for the library that we know, that the college administration has, the college administration also has some development partners that help in funding the library, and we get donations for the library in terms of books and even money. For example, in 2021, we received a very big donation from Books to Africa. That is an organization from UK. We got over 30,000 books
Interesting.
for the library, and we got about 20 computers and 20 laptops for the library. And then apart from that, Books for Africa also get books from Book Aid International. That's from Chambogo University. We get books from Book Aid International. And also of course, we got books from Enabel today, because this library was constructed by the BTC, Belgium Technical Corporation.
Okay.
Then and now it's called Enabel. So apart from the budget that the college has for the library, the college also collaborates with other development partners to support the library. And that's why you realize that our stock, at least the library, I cannot say it's completely stocked, but at least we have information resources that can support the teaching and learning process. And as I talk now, I've even been working with that gentleman you saw on how to acquire new books for the library. So even I think by starting next month, we shall be even receiving new stock for the library.
Okay.
Yeah.
What's the level of utilization of the library in
Our-
terms of learning?
Our level of utilization, I must say it is good. Because our library, if you look at the capacity of our library is meant for 115 users at a time. But you realize in a day, on average, according to our statistics, because we compile here statistics for the library, we get about 60 to 70 patrons.
Walk-ins.
Yeah,
Okay.
who use the library in a day.
Okay.
But then you also realize that basing on our programs, because we have in here 3 programs, the PGD's postgraduate diploma in medical education, who study over the weekends, then the higher diploma in clinical instruction, who are on a modular program, they come in intervals, they are not there full time. Then of course the BME, the Bachelor of Medical Education, who are there on full time. But then with these 3 programs, you realize the PGDs come on weekends, so they are not there during weekdays. But then the the bachelors of medical education, they are always there full time. But then during the day, like from morning up to 4, they are occupied in class. So the level of utilization of library is minimal. Okay. But then the evening, you realize evening time, our library will be full. That's why you see, if you look at our operating time, you realize our library opens at 8 a.m. in the morning and we close at 9 p.m. because we want to consider those people who, after their lectures, that's the time they'll be having to use the library. So in the evening, we're having here people who are using the library. Then over the weekend, we open from 8 and close at 6. So if during weekends, you realize our library is full. The users are there. But then also, according to our statistics, we also realize that the males tend to use the library more than the female. We don't know why, but then that's something that we've captured, but we want to carry out research and see why females are not using the library as often as their male counterparts. But our level of utilization is good.
I'm here at the Health Tutors College, the Skills Laboratory in Mulago, and I'll be interacting with one of the in-charges who will be telling us more about this place and what it entails. You're welcome. Please introduce yourself.
Yeah, thank you so much. My name is Ivan Nshabire. I'm the in-charge Skills Laboratory here at Health Tutors College. The Health Tutors College has got 3 laboratories. We have the midwifery laboratory, we have the allied skills laboratory, we also have the nursing laboratory. Maybe one would love equally to know what a skills laboratory in a training institution is about. Yeah. So when we talk about a skills laboratory in a health training institution, we mean a replica of a patient care environment. It means a clinical setting within a training institution, where students have to be first exposed to the skills. This laboratory is equipped with models and equipment. So these students have to make use in order to augment their skills. So remember, our students are already qualified health workers, but they want to go out there to train other health workers. Yeah. But you find that one maybe has been working in a health facility in a particular department, say in theater. Yeah. So when they come here, they equally have to remind themselves what is done, for example, in a family planning unit, what is done in the surgical department, and they again reawaken the skills that they had gotten. Okay. So the skills laboratory is equipped with models, as you can see. It has other instruments. So these students keep practicing so that they can become very competent. They gain the competencies. So that when they go out there, they are able to teach the young ones or other future healthy workers.
Okay, because when I walked in, I saw various props. I'd like for you to take us through different props here, what they stand for, what they're supposed to teach.
Okay,
yes.
As you can see, you know you have ever been to a clinical setting or a hospital. Okay. So this environment somehow resembles that environment in the hospital setting. So where you find, for example, patients. So this one is our patient. We take them to be models. And for example, this one, when our students are interacting with this model, we expect them to show the attitude and the skill they would use while interacting with the real patients when they go out there. So this model is handled the way they handle a patient. And then we can tell that this one student has got good attitude, and then we advise them on how they should go ahead so that they can transfer that when they start teaching other students elsewhere in the different training institutions. So you can see these screens, of course, they are to provide privacy. Then we have some of the equipment that and other models. For example, this one is a breast. If you touch on it and you feel it, for example, it resembles the real human breast. For example, if one is doing breast examination to see if one has got cancer of the breast. Then they have to start with this one and then see how
A healthy breast film.
yes, if it has some solid mass inside, then they can take.
I'm joined by the Deputy Principal of Health Tutors College Mulago. He will be introducing himself and telling us more about his role. It's an honor to have you. Please introduce yourself.
Happy to see you too. I'm Katumba James Davis. I'm the Deputy Principal of Health Tutors College Mulago. I've been in Tutors College from 2013 up to date.
Okay.
Yeah.
What is your overall responsibility as the Deputy Principal?
As the Deputy Principal, I coordinated activities. We draw programs before the semester commences, so that all these programs are programmed before time. And as we draw our programs, we liaise with the different stakeholders, the hospitals, the health training institutions where we send our students for school practice,
Yes.
the communities, so that all those activities can fit in within a semester, and they also fit in with the programs of our stakeholders.
How long do the outdoor, I'd say out of school experience, when they go into the field, how long does that last? Is it like their internship?
No, it depends on the curriculum or the curriculum. Each competence or the skills they need to acquire for a particular location or placement determines the period.
Okay.
There are those placements which take about 3 weeks, others take a month, and other placements take almost 1.5 months. For example, school practice can take up to 1.5 months.
Okay.
Yeah.
How do you coordinate with the administrators in those institutions to know that your students coming from here are actually doing the right thing, the right things that you've taught them?
Oh, once we place the students, in the hospitals we have what we call preceptors.
Okay.
The preceptors take care of our students. They guide them, they teach them, they mentor them
Yes.
when they're in the field. And also we do support supervision. We regularly check on them, and also they send us reports. They're supposed to, the preceptors or the in-charges are supposed to give us reports.
Yeah.
For school practice, we send them to health training institutions. The principals and their mentors and supervisors keep monitoring and checking on them. And then we do support supervision, and we also do examination. Yeah. So we have periodical checks. We keep checking on them.
Are they graded for that experience as
Yes,
well? Is it part of their final?
it's part of their final assessments.
Okay.
And they get a mark or credit for the work done in the community.
And that brings us to the end of this week's episode on Education Forum. Our focus today has been navigating medical and healthcare tutorship here at Health Tutors College Mulago. My name has been Maureen Bavidia. See you next time. Bye-bye.